So why so dedicated to Andrew Yang?
I really think that Andrew Yang has the solutions that we need. He understands automation in a way that none of the other candidates do. He's better qualified than two of the candidates up there as far as polls are concerned, but he's the only candidate that has really innovative ideas for a way forward. My background's mechanical engineering. I have received and am writing patents for new transportation technologies for underground high-speed electric vehicle transportation, including automation of trucking. And it's coming faster than even Andrew Yang knows. And lots of Americans are going to be out of work if when automation takes over. So people are going to have to learn different things. I, for one, was homeless 4 years ago. I lost my house during the housing bubble collapse. I lost it because I lost my job. Long story I won't bother you with. But I had a lettuce farm, 1,000 heads of lettuce a week, but I had aphids in the farm. I couldn't get it going, and then it got into November where everything gets cold. We live in the mountains, so snow. And the farm was going to be pretty much dead for December, January. I couldn't afford it, and so I had to. I had no income, and I was evicted, and I was homeless. So 1,000 a month, I would have weathered that and been able to continue doing the farm.
1,000 a month would have made all the difference in the world for you
Would have made,
in California.
yes, in California. Well, I'm in the mountains, Grass Valley, outside of Sacramento, so we're in the Sierra Mountain foothills, 2 to 3,000 foot elevation, but it still snows. One winter we had 3 feet of snow.
But what I'm saying is like in a city like Oakland that's incredibly gentrified, $2,500 is the monthly rent, the cheapest you can find for a one-bedroom apartment. What's $1,000 a month going to do for those folks?
It's a minimum wage amount, okay? It's not going to be money that you're going to kick back on. What it is a foundation, and from there you can earn more money. For example, right now, the way welfare works, my income for the past 2 years has been essentially minimum wage. So I'm considered poverty level. Even though I'm a mechanical engineer, I can't find work where I am.
Somebody that works at McDonald's, even with the UBI, would just be able to maybe afford their rent. No, we're not even talking about light, gas, water, power. You know what I mean? Like all these other things, and $1,000 a month isn't really. And then on top of that, we got the healthcare situation being what it is. Andrew Yang has said that he's not for Medicare for all. He's for the spirit of Medicare for all. But I've read his plan; it's not Medicare for all.
Okay, that's an excellent point that a lot of people think, but they're misinterpreting. He's not for the plan, Bernie Sanders plan, Medicare for all, because that would create Medicare for all, but it would ban private medical insurance.
If you have private medical insurance, you don't have Medicare for all because Medicare for all is single payer health insurance. Single payer is what we're talking about when we talk about Medicare for all. We're talking about abolishing private insurance in that private companies don't profit. And when private companies profit off of health insurance, you have death care, not health care.
I hear that, but it seems to me the best excuse me, the best way is to have it to be where you have the public option for anyone who wants it. So you can go in. If everybody said, I want it, it would be Medicare for all. But if some people say, I like my private insurance better, they can have that.
Have been covering this campaign and this debate and for a long time. I have not met one person that says I like my insurance company. Nobody likes the insurance company themselves. They like that their bills getting paid. You know what I mean?
Medicare, okay? I'm on Medicare. And
Honestly, there's improvements that need to be made to Medicare, but the point itself is, and actually Medicare for all is technically Medicaid for all, but Medicare for all is the word that everybody's using. However, the idea itself right now is that single payer is what folks are wanting. And
everyone who wants it has that under Yang. Because if you want that, which is the single payer, the Medicare for all, then you say, that's what I want, and then you get it.
But if you leave,
If you want to pay more,
if you study predatory capitalism and its history and how it's worked, when you leave capitalists the option to have money in politics and buy the politicians that write the laws to change the rules, then you leave insurance companies an option to change the laws in their favor and sabotage. Look at the post office itself. That is the perfect example of that. The post office has been sabotaged crazy. It's been sabotaged to where really it's been sabotaged crazy because of the law, the way the laws have been changed.
so I haven't studied the post office, so I can't speak to that. Okay. I have studied the Medicare issue, and I can speak to that. And the way capitalism works is that you allow any option, anybody can do anything they want, and people will choose the option that's the least expensive. So if a Medicare option is available to an employer that costs half the amount of the private care, the employer's going to say, hey guys, do you want me to continue this private care, or would you rather have me switch our company over to the Medicare for All system of Andrew Yang?
When what we're talking about Medicare for all, that's why it's called single payer. There is no going through the company.
Right, right. Let me avoid the naming convention. Let me call it Medicare for everyone, okay, instead of Medicare for all. So
What I'm saying is like we're even if it's Medicare, like it's single payer. There is no employer involved. Like the employer doesn't have a say in that because the employer it's not tied to your employer anymore.
today, that's the way it is. But in the future, it could be each person says, I choose the Medicare public option. And then the employer would say, okay, fine. Then instead of paying $2,000 to the private, then I'll pay 1,000 to the Medicare option that Yang sets up, plus $1,000 to you. You see? So it's like we're paying double today. So it's simple to create a different option that costs less. It is simple because we have the structure for Medicare already. And so all we need to do is to offer that solution to everyone. Okay,
So
everyone.
offer them the option to let their employer make the decision over their health care outcomes.
No, they can make the decision themselves. They can their employer is paying a certain amount today, right? Okay. And he's paying twice as much as
But you're missing my point though. My point is that if we have a single payer system, we don't rely on the employers anymore at all. So you lose your job, you don't have to worry about that affecting your healthcare outcome. You know what I mean? Like if you lost your job because you got cancer, the last thing you worried about is finding another job right now. You're trying to fight cancer. You know what I mean? That's a bigger, way more important fight. And there's plenty of folks that lose their jobs, and now not only do they got to go to chemo, they also got to go deal with insurance companies, and it's set up that way on purpose.
yes, and that's where the insurance companies are corrupt.
So why not get rid of the insurance companies, period, and just have it be single payer like the rest of the other developed countries in the world, where it costs half as much.
Because of a very important criteria that we have in America, and that is freedom of choice. So if a person wants to pay double to a private company of what it costs to actually cover them, they should have the right to do that. If a person instead would rather pay half and then get an extra amount of pay from their employer because their insurance is costing half as much as the other employees.
Do you understand how insurance works? Insurance works because the healthy people are basically paying for.
Former CEO, I'm a mechanical engineer, business owner. I've bought the insurance, I've made the payments, I've been the employee, I've had the employees under me. Yes, I understand how it works.
I mean, what you're saying though is showing that you don't have the understanding of the basic, because healthy people paying the insurance puts money into the pot for them to make those payouts.
You just watched Status Coup's In the Field coverage with me, live on the ground from Iowa. We can't do this without your support, so make sure to like, share, subscribe, and become a member at statuscoup.com.